India has seen rapid development in the past 2 decades, but it has come at the cost of increasing pollution. According to environmental experts, power plant emissions, traffic emissions, household fuel burning, waste burning, and construction dust are main causes for air pollution in cities, while crop burning is another source in rural areas. In a recent report from the World Health Organization, India has 14 out of the 15 most polluted cities in the world in terms of PM 2.5 concentrations, based on 2016 data.
I think that what we've seen is a lot of very innovative programs being put forward by the government. So obviously that shows the government is aware of the issue and is rolling out various measures. I think that though these actions really need to be, all year round. I mean, oftentimes what we've seen is a few measures being done over 1 or 2 week period, which may get a sense of their the popularity of such measures with the public, or how feasible they are to do, how intrusive they would be on people's lives, but are not really going to be sufficient to be able to measure any impacts.
To actually bring down pollution, I think it failed. And there is enough research now that I have read about which actually proves that it did not end up bringing down pollution at all.
The bigger question might be, why can't India, which has made enormous strides fighting poverty with ambition to be a superpower, get a good handle on its air pollution?
If you look at India, on the contrary, during last 1 decade, there has not been any significant action taken on reducing air pollution levels. It is just very recent when the Environment Ministry for the first time has recognized air pollution as a national crisis, and they came up with the response National Clean Air Program for that. Although it's not entirely true that Indian government has not done anything till now. They have been taking some specific steps here and there in at least in and around Delhi, but all those steps have never been systematic and comprehensive, and because of lack of implementation and lack of proper political will to drive those measures in a systematic and comprehensive manner, we were not able to achieve the improvements in air quality which we were seeking.
There are two things. In some areas, there are no regulations. In other areas, there are regulations, but they are not being enforced. So even, for example, where you are generating power, but you are not following the power stations or the cement companies, etc. Industry is not following the regulation that they're supposed to follow. So it's a combination of the corruption that comes at the different levels, where, let's say, I'm a power company and I'm supposed to follow certain rules and regulations so that I don't spew out smoke into the environment, and I'm not following that. And the person who is supposed to regulate me comes to my power plant and tells me, what you're doing is wrong. And instead of cutting me a fine or making it difficult for me to pollute my environment, just takes a cut on the side. That's, again, a problem that a lot of countries like India have, where the enforcement is not being taken seriously.
The government as well as industry, big industries such as power plants and steel plants and other industries were hiding behind the public. And what happened because of that was that for 2 years, the debate was only circulating around the cars and biomass burning, which to me are one of the biggest sources of pollution and should be tackled in a very strict and time-bound manner. But what we shouldn't allow that to do is to hide these big industries and big polluters behind those people. There needs to be equivalent amount of stress on the actions to be taken on industry as well.
Well, the only thing to do to safeguard the health of citizens is to tackle the issue at the source of the pollution and to stop the emissions occurring in the first place. Have to do it the end of the pipe rather than downstream. That's how we want to work with the government. I think that we do read a lot about other measures that can be taken in terms of air filtration, use of masks and so on, but they are largely at the downstream end of things. And we don't think that we should be asking the sort of citizens to pay for those, which of course most of the citizens would not be able to afford such protective measures, it should be tackled upstream so that everybody benefits.
The WHO called on India to copy China's efforts to clean up its air, years after Beijing topped the list of the world's most polluted cities. But governing air pollution is much trickier in India. A large problem lies in the bureaucracy. India has a large number of laws, rules, and guidelines to control air pollution. While the central government plays a leading role to roll out these regulations, the state government lacks ambition of implementation with limited capacities and allocated funds.
We are not China. We are a very different kind of country with very different government makeup.
We need to learn from China. It's not that we copy the entire plan from Chinese government, but we definitely have to learn a few things from there in terms of making it time-bound, making it sector-specific, making people and authorities accountable for the improvements and non-attainment of reduction in pollution levels.
India is ruled from the center. It's a democracy, so there is a government at the center, and there are also state governments which have their own sets of rules and regulations, and there are so many layers of bureaucracy that even if there is a particular law that is implemented from the center, it is hard to get every single state to buy into that law and start implementing it. They also have different bodies. There is a Central Pollution Control Authority. There are the state pollution control.
The action that government is taking, the central government is taking, is not sufficient to clean the air quality across the country. Maybe in Delhi we will be able to improve air quality, but air quality problem is across the country, especially in northern India. And therefore, we will need the involvement of regional governments and the local governments to clean air quality. Now, that involvement of regional governments and local government is not happening. There is a capacity problem at the local government, especially. Local governments don't have capacity to enforce many of these laws. Also, many local governments are poorly financed. They do not have money to implement many of these programs.
Lack of the funds as well as lack of clarity on accountabilities and authorities responsible to take decisions is definitely something which will bother the state pollution control boards, because air pollution cannot be controlled by just regulating one sector. For example, we cannot reduce air pollution only by reducing waste burning in the city. We cannot reduce it only by controlling the transport or only by controlling the diesel generated set or electricity. There needs to be a mechanism or a committee wherein all these departments are part of. But when that happens in India, the lack of clarity on who becomes the final decision-taking authority, who can direct all these departments to move in a certain direction, is missing.
While different state governments are blaming each other for the alarming pollution crisis, the country still failed to declare it as a national health emergency.
First is that we should start demanding our right to clean air.
Not enough people are aware, and not enough people realize that this is actually an emergency that is going to affect their health, everybody's health over a period of time.
The work on air pollution has to start from individual and the local level. It has to be a citizens' movement. We will have to make sure that public transport is subsidized and the service of and the public transport service is improved significantly. We will have to give viable technology to farmers so that it is affordable, and instead of burning, they use those viable technology. So the role of the government is to create facilitative environment of incentives and disincentives so that then citizens can take action. At the end of the day, most of the work happens in self-interest.
As general citizen at my household level, what I can do is I should reduce my waste generation. Segregating waste, putting it in a proper disposal format wherein it doesn't end up in a landfill where it is been burnt is one way that we can segregate it.
In this context, there were high hopes for the National Clean Air Programme, which contains a discussion of ways to monitor and measure urban air pollution and to apportion responsibility for pollution loads in a more detailed way than at present. It proposes to increase the manual air quality monitoring stations to 1,000 from 691 at present, and add 50 more stations in rural areas. Currently, there are 691 monitoring stations in 303 of the 4,000 cities in India, and none in rural areas. It also proposes to strengthen the number of stations monitoring PM 2.5 to 1,000 from 67 stations at present. However, various stakeholders, including some citizen groups and experts, feel that the plan is high on words but lacks a clear strategy, timeline, and specific targets.
WHO is not alone in providing some comments and feedback to the government about how to make this program better, and has been working with a number of UN agencies to make a consolidated response and to provide some helpful suggestions of how the program could be made better. And one of our observations is at the moment the scheme is focused very much on the monitoring of air pollution, which is obviously very important. I think that whilst India has many hundreds of air monitoring stations in a country the size it is, then obviously the more, could benefit from more monitoring stations. But we feel that a part of the program, should be directed towards the sort of actions to stamp out some of the sources of the air pollution rather than just monitoring trends. At the moment, what the proposals have been largely to do with improving monitoring, which is of course a very essential part of the equation, but doesn't address all of the measures needed to protect health. I mean, you can't just monitor the problem and they go away. You have to actually take action.
The first thing is that it lacks the time-bound targets. Until unless a national clean air program or action plan or a policy knows where we have to move in 3 to 5 years from now, we would not make significant progress, and we will never be able to measure the interim milestones of whether we are moving in the right direction at the required pace or not. So what is definitely required in the National Clean Air Program is to have set time-bound targets in the long run, as well as immediate milestones to be measured in 6 months or a year, every 6 months or a year. So therein it needs to be strengthened. Second thing is the National Clean Air Program in India doesn't talk about the big industrial polluting sources. It doesn't have a mention of thermal power plant sector in it. It doesn't have a mention of all other industries in terms of what is the timeline which will be granted to all the industries to retrofit to the more stringent emission standards. And if they don't do that, what's going to happen? The National Clean Air Program doesn't speak of any sectoral targets, and until unless we know how much we have to reduce and where to reduce, we'll never be able to achieve air quality improvements. The third thing in this plan is also that any plan needs to have fixed accountability. I was reading a news just a couple of days back, and the news said that in Hebei province there were about 12 Pollution Control Board officers which were penalized or which were given notices because they were not able to reduce pollution levels and the activities were not going in the right direction. In India, the National Clean Air Action Plan, although speaks of a committee to be set up or of a structure to be created, but in terms of fixing clear accountabilities and what happens if they don't achieve the target set in the National Clean Air Program is not very clear. The fourth thing is any national clean air program or action plan which has to reduce pollution levels in an effective way in a time-bound manner, we should have clear budgetary allocations or clear allocations from the central government, state government, and where the funds will be flowing from for all the actions to be taken under this plan. That seems to be a bit ambiguous. The National Clean Air Program just says that there will be about 635 to 40 crores rupees which will spend on formulating the National Clean Air Program, but the money, the huge amount of money which will be required to implement it will again has to be borne by the states. and that seems to be a bit ambiguous. There needs to be more clarity on how this is going to be implemented, because states might not have the will to do it, they might not have the financial resources to do it. So a policy has to clearly mention that as well.
When you have a general program out there, it really doesn't add value, because it's like you and I sitting and talking about it, but not really doing anything in a time-bound fashion and saying that, okay, here's our goal for 2020, this is what we're going to try and achieve, and if we achieve it, then we'll try and get to the next stage. If we don't achieve it, then this is what we do. It should be a more a plan with greater clarity, and I don't see that at this point. It has no real goals in there. It's a very generalized plan, and we need to have more urgency in that plan. It is not urgent enough.
The number of chronic pulmonary disease and lung cancer cases are rising among non-smokers, particularly women and children. In 2015, of the 6.5 million air pollution deaths worldwide, the largest number, 1.8 million, lived in India, according to the Lancet Commission on Pollution and Health. Diseases attributed to air pollution are now the second leading cause of death in the country, after child and maternal malnutrition, accounting for nearly 10% of all premature deaths.
We have got an increasing number of lung cancer patients. So that I personally attribute it to the pollution, and what we have observed over the last 2 years, which we studied into 2 years back, that we have got lot more number of lung cancer from rural areas, and the number of patients among them who are smokers are very less.
जैसे धुआं धक्कड़ आए तो दम फूलने लगता है, खांसी आने लगती है, यही परेशानी होती है। जैसे गले में लगता है कि जैसे कुछ चुन 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 करता है।
So it is not just the government that is responsible. All stakeholders, corporates are responsible, governments are responsible, citizens. We are all going to die by breathing this polluted air. We all need to make a difference and protect our children, because there is no solution apart from making those laws, following those laws, using better fuel, and trying to make our air safer for us to breathe, because we don't have an option in breathing. You can clean your water, but how do you clean your air unless you're walking around with an oxygen tank?
We obviously would like to see the issue being taken up at the highest levels of government, and so this high political support for the issue is necessary, because the issue is impacting on so many other different ministries and stakeholders. So that's key, and we would like to see the Ministry of Environment and Ministry of Health really taking a leadership together in coordinating some of the actions. We'd like to see the Ministry of Health, playing a very strong role to ensure that the health impact of various measures is obviously built in at the design phase and is evaluated, so that we are doing things which to protect health. I mean, we often hear of giant vacuum cleaners being erected sort of at the corner of the road, and being to reduce the concentration of air pollutants, but that's not going to impact on people's health. And in terms of some of the priority areas that do impact on health, then the use of solid fuel for household energy purposes, such as cooking, and kerosene for lighting and things like that are very key. And that's another area where the government has been making very good inroads in terms of electrifying all of the villages in India. So it's building on those successes to make sure that the households have clean fuels available for their daily needs, such as cooking.
There has to be a lot of individual initiative and local government initiative if we want to solve air pollution problem. And citizen groups will have to come together across the country to do, take their own initiative. And government can provide facilitative policies and incentives so that industries can move to cleaner technology, transportation. We can move to public transport and build public transport infrastructure. We can incentivize farmers not to burn residues. Those are policy instruments. But the work will have to happen at the local and state government level.
I think when people realize that, and when governments realize that, they're going to realize that they are following, growth rates of 7%. But at the end of it, if a lot of the population is sick and they are going to, have low productivity, even if in economic terms, it doesn't make sense to have this kind of growth-centric model where development is not being given enough of importance.
The surrounding countries such as Nepal, Bangladesh, and even Bhutan has it. There's the airspace doesn't stay within our geographical and country borders. It's one air that we're all sharing. So it's very good that India has a lot of attention and a lot of people willing to help. But I think that the other countries of the region, which are also rapidly developing, both industrially developing and urbanizing, they also need to have the attention from the media and scientific support and support from international agencies and other countries as well.